it became evident that implant survival depends on some criteria, and we should follow all of them. But look on this case and what we can do with soft tissue. For example, this is actual study about effects of soft tissue augmentation, and we can change some parameters. First of all, thickness, mucosal thickness, and of course, keratinized tissue. In my practice, for same cases, I use connective tissue graft harvesting from tuberosity area. We know that improvement of volume is predictable process. But what about keratinization? I think many clinicians know that when we use connective tissue graft around implant, spontaneous keratinization is not predictable. And today, I want to show you some actual interesting studies about this process. First of them, this is publication about relationship between mucosal thickness and spontaneous keratinization. Less thickness tissue, better spontaneous keratinization over connective tissue graft. And second experimental study, this is study about also spontaneous keratinization, but look on this information. It was concluded that if keratinized tissue absence on primary flap, spontaneous keratinization is not formed around placement even if connective tissue graft is placed. What we can do in this case? Of course, considering all the above, in this case, I formed a partial thickness flap because we know relationship between thickness and keratinization. In this case, I used connective tissue graft, but not standard protocol. I use epithelial-embossed connective tissue graft because on primary flap, absence level of keratinized tissue. And look on this slide. We can use connective tissue graft, which consists with two parts, epithelium and collagen. And after stabilization of connective tissue graft, we should have good contact and reliable contacts with epithelium of grafts and the epithelium of primary flap. Look on this photo after 8 weeks after healing. Everything look great, I think. If we look from lingual side, we see change from recession to new volume of soft tissue, then 2 millimeters. In next stage, I made augmentation around the second implant in the same protocol. I used epithelial-embossed connective tissue graft, and the reliable contacts between epithelium of graft and epithelium of primary flaps was achieved 3 months after surgery. I achieve incredible volume of soft tissue and, of course, new level of keratinized tissue. Soft tissue components, mucosal thickness, in this case, at least 3 millimeters. I ensure that this component influence for peri-implant health in the future. And keratinized mucosa width. Please look for results. We can new level attachment tissue around implant, and of course, we see attached tissue. I think if you have good level of keratinized tissue and volume, you can discuss replace bone for connective tissue graft around implant, because no indication of inflammation and good primary stability of implant. Please compare result before and after. We made finally crowns, and you can see a result after 3 years post loading this implant. Everything looks wonderful, I think. Then I would like to talk about immediate implant placement. We know that it's very predictable protocol in daily practice. Of course, after extraction of tooth, we can placement implant immediately. But in my opinion, you should follow some criteria to achieve good results of treatment. In my practice, I use Nobel parallel because I think that design in combination with TiUltra surface is more favorable for aesthetic and functional outcomes. And we know that immediate implant placement and temporary crown maintain bone and gingiva of same level in the future. We should remember about bone augmentation around implant. In my practice, I use xenograft for socket preservation. Of course, it's most important with thin buccal plate. It's necessary to use connective tissue graft for augmentation in this space, and together, grafting of bone and connective tissue graft are favorable for implant success rate, of course. After 4 months, you can see good results after healing. This situation after temporary crowns. And of course, we talk about new parameters of tissue. There are mucosal thickness and keratinized mucosa width. Clinical view of final crowns after 3 years post-loading. Good level of soft tissue. And of course, we see a good level of bone around implant. Please compare before and after. And in my opinion, if you follow all these principles, of course, bone grafting around implant, soft tissue around implant, your result will be predictable, of course. Final smile of patient.